Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster with my guest here, Shruti Gurudanti, CEO and co-founder at Televëda. Shruti, great to see you.
Thank you so much.
It's been great to watch your journey, learn how you're helping seniors with issues of loneliness with your platform, but I know you're doing a lot more than that now. So sort of level set with us, where's Televëda at in 2023?
We have a very exciting project right now with the in partnership and thanks to the support from the Veterans Administration, where we are building a comprehensive operational plan to help reduce suicide deaths amongst Native American veterans. And the plan or the comprehensive solution includes a culturally specific behavioral health intervention, which combines Western medicine with storytelling and talking circle interventions, which are culturally specific to Native Americans, again, with the intent to help lower suicidal ideation amongst Native American veterans. But the plan also, or the solution also includes doing something a little more basic, which is deploying internet access, broadband access, digital literacy skills within our communities. And the most revolutionary concept of all is just building trust with our community. Really listening to our veterans, listening to our Native American veterans, and understanding what is it that they need and how can we help address the concerns that they have.
Isn't it interesting that sometimes the bedrock foundation of an innovative something as simple as trust, connection, or even a broadband internet connection?
Absolutely. Here we are talking about communities that unfortunately have suffered from persistent structural inequities that have created these suicide disparities today. And so it is absolutely important that we look at low-tech solutions to help address some of these concerns. And that's why we're starting with something so basic as, okay, can we go into the communities and first give access to broadband, give access to devices, teach people how to use their devices. And even before that, when we talk about how do we help bring social connectedness? We are looking at low-tech solutions like the radio to talk about, the available VA resources and that, we care, we're here for you, we're listening to you.
Yeah. How did you get into this work, specifically wanting to help Native Americans, wanting to help people dealing with suicide and loneliness?
It's a funny story. I have the privilege and the honor of working with some Indigenous public health officials, and we got into a conversation about how anytime we think about suicide and suicide deaths, we have to really understand that the Native American population has culturally unique issues. They have historically been disenfranchised. There is historical trauma. And so when we think about solutions for suicide prevention, we have to respect the fact that we have to look into culturally unique and culturally specific solutions. And so in talking with my colleagues who are Indigenous public health officials, we thought about, okay, how do we help address this problem by creating something that is culturally unique to our tribal communities? So that's how it all came about. And we're lucky to have support from some really amazing tribal communities today that are, and of course the VA and the Veterans Administration through Mission Daybreak, that we're able to really push forward with the solution.
It's exciting that the VA is funding something like this.
Yes.
In this project, as well as your work with senior loneliness, how are you seeing the macro conversations shift in terms of priorities of funding, just across the board?
So when we think about senior isolation, or whether it's our veterans, I think the focus of Televëda from the very beginning has been, our overarching mission has always been how to address and alleviate social isolation and loneliness amongst our most vulnerable populations. Seniors just happen to be, unfortunately, folks who suffer from isolation and loneliness, more than other communities, I suppose. And the thing that I think we focus on and do really well is we use tech as an enabler and not as the forefront. I mean, AI, VR, I mean, you'll hear a lot of these solutions trying to resolve isolation, loneliness, but really what people want to see and really what people need is they don't need another mental health app. They don't need another application or a software tool that'll help reduce isolation. What they really need is you and I coming to them and just talking to them and listening to them. And so what we really focus on is, even though it's, from a scalability perspective, it takes more time, but we go into people's home to teach them how to use their devices, to make them feel comfortable, to make them feel empowered. Once that digital inequity is bridged, then we can talk about closing the gap on health disparities. So it's a simple, but in our minds, that's the best way to address isolation loneliness, is to empower people by doing the most basic thing, talk to them.
I love the ethos behind it. I love the direction you're going. It does cause me to ask about your business model. Who pays for it when it's so high touch?
Yes, great question. So we get paid by Medicaid plans and Medicare Advantage plans. And so this is something new that is coming down the pike. In 2024, CMS has come out with a new rule that all MA plans absolutely have to create a digital literacy assessment tool so they can assess what is the digital literacy skills that their MA members have. And B is provide them with digital literacy. And it has to be culturally specific and culturally, tailored. So if it's a Spanish-speaking member, it has to be in Spanish. And so that just shows to you where CMS's head is at. Yeah. They have recognized that our just providing coverage is not enough. There are digital inequities and health disparities that are being created because people don't know how to use their devices. I mean, there's such a push on telehealth, but people don't know how to use their telehealth. It's sometimes frustrating for someone like me who's tech savvy. I have 5 different doctors with 5 different apps, and I have to go and schedule an appointment on different apps.
Me too.
So if CMS is pushing this forward for MA plans, I am fairly certain that this is going to come down for all of the other Medicare, Medicaid coverages as well. But again, it goes to show that it is important that we include people and teach them how to use technology. Not everyone grew up lucky like you and I.
So you see the trend, you see yourself as maybe one step ahead of that reimbursement trend, but that it's coming down the pike.
Absolutely.
Yeah.
So plans that we are working with right now have already seen the need to create digital literacy amongst their members. And I think they're ahead of the curve because absolutely this is happening and it is coming down the pike. So when we teach our members how to use their devices and then we connect them to our platform, which also connects them to micro communities, and they find friends and groups and things like that, what we are ultimately doing is creating that member retention for them and creating that trust factor again with the plan. And we have the assessment tools that we provide to the members so that we know who, how educated they are. So I think the plans we're working with, of course, are ahead of the curve, but it is something that is absolutely coming down the pike.
So if I'm hearing you correctly, you have this platform for seniors that helps connect them into micro communities.
Yes.
Right? So, but you're being reimbursed for a piece of the platform that does education, literacy, patient literacy education.
Yes. So we essentially, if you want to split what we do, we have a digital literacy assessment tool, which is our first step. So we assess members on where they stand in their literacy skills. And then the second piece is to teach them how to use their device, whether that's a phone, it's a laptop, whatever device that they have that they want to use. And we don't discriminate based on it's only telehealth, it's only going to be X, Y.
Yeah.
We teach them everything. You want to learn how to use YouTube? Sure, go ahead. We will teach you how to do that. And once we do that, then the third sort of segment is we connect them on our Televëda platform to micro communities of other people who share the same interest. So what I mean by that is, we've been doing this for several years, and what we've learned is nobody wants to acknowledge that they're isolated or lonely. There is a stigma attached to that. And so, but instead, they will say, oh my gosh, I miss doing yoga. I miss doing, my art class at the senior center or what have you. And so once we learn about their interests, then we connect them to that micro community of members that exist on our platform. And the one thing that I can almost guarantee, and not almost, I can absolutely guarantee, is that every micro community on our platform is extremely welcoming because they've all experienced that isolation and loneliness.
Got it.
So when someone new joins, they're all about it. They will welcome you and they'll make you a part of the community. So we know that once someone joins platforms on our community, they're consistently coming back month over month to join that particular class or that particular program because it becomes a part of their routine. Now they have something to look forward to make their bed, get out and start their day.
Love it. Shruti, thank you for coming by and giving me an update on Televëda. Exciting to hear about this project with the VA and with...
it's called Hero's Story.
Hero's Story. Okay. Okay. Can they read about it on your website? Or?
Yes, absolutely. Okay. If you go to televëda.com, you can read everything about the Hero Story as well as all of the other things that we're doing.
All right. Keep up the great work and we'll get an update next time we're together.
Thank you so much, Logan.
All right. Thank you, Shruti.
Take care.